Hello and welcome. This is TV360 News Now. I am Deji Badimasi. Health authorities in Nigeria have confirmed that 2 more persons have now been infected with the Ebola virus. The new infections bring to 9 the total number of Ebola cases in the country. 2 persons have so far died of the virus, including a Liberian man, Patrick Sawyer, who was the first reported case in Nigeria. Minister of Health Onyebuchi Chukwu at a media briefing in Lagos says all those infected had direct contact with Sawyer, who died of the disease in a private clinic in Lagos last month.
Since the last time I addressed you on Tuesday, when I informed the global community that Nigeria has confirmed 7 cases of Ebola virus disease in Nigeria. Between then and today, we have additional 2 confirmed cases. So the total now, we have 9 confirmed cases, of which 2 are late. The same 2 we told you about, the index case and the health worker who we unfortunately lost some days ago. I want to reiterate again that in the last 48 hours, we've confirmed 2 additional Ebola virus disease cases here in Nigeria. They are Nigerians, and they are people who have had contact with the index case. And as of today, our fatality is only 2, but it's a lot because we didn't want anybody to be lost. 7 are surviving of those who are positive. We are still treating them here in Lagos. We have some suspected cases that we've started investigation, and when we get the results, we'll also confirm results, we'll also let the media know.
Well, President Goodluck Jonathan on Friday declared the control and containment of the Ebola virus in Nigeria a national emergency. Presidential spokesperson Reuben Abati in a statement said the president has directed the Federal Ministry of Health to work in collaboration with the state ministries of health, the National Center for Disease Control, the National Emergency Management Agency, and other relevant agencies to ensure that all possible steps are taken to effectively control the threat of the Ebola virus in line with international protocols and best practices. He added that the president had approved a special intervention plan and the immediate release of 1.9 billion naira for its implementation. According to Abati, the fund will be used to further strengthen ongoing steps to contain the virus, such as the establishment of additional isolation center, case management, contact tracing, deployment of additional personnel, screening at borders, and the procurement of required items and facilities. Now, earlier today, there was a widespread rumor, especially in social media, that taking one's bath with water mixed with salt could prevent one from contracting the Ebola virus. The rumor went viral on social media, and some people reported receiving text messages to that effect. Now, we understand some people, especially in the east of the country, woke up as early as 5 a.m. to take their bath as instructed in the messages. While the health minister addressed the issue at the media briefing, here's what he said.
Some evil-minded persons, very wicked at that, have been circulating through all available communication channels, including mobile phones, tablets, whatever, and claiming that ordinary hot water, and if you add salt, will prevent Ebola virus disease. That ordinary water with salt will cure Ebola virus disease. This is complete lie, total fallacy, wicked lie, wicked rumor. We are going to go back and discuss with the appropriate authorities and look at our laws. We need to fish out these people, and they have to be arrested. They will be prosecuted.
Well, we're waiting for that to happen, and it's quite unfortunate that some people would take advantage of the Ebola situation in the country. Well, Minister of Information Labaran Mako, who was also at the media briefing, appealed to religious bodies, especially churches, not to harbor Ebola patients hoping for a miraculous cure, but advised them to go to the hospital. Now, there have been reports that some of those who may have come down with the virus have now turned to churches hoping for a cure.
All of us here believe in God, and we take prayer seriously. We know that prayer is efficacious. If you have faith, prayer is very important. And we commend Nigerians that continue to pray for this country and for the rest of the world. However, we are also dealing with matters of public faith, public health. It will not be helpful at this point, in my opinion, and this is the opinion of the federal authorities dealing with issues of public health, for crusades that attacked this Ebola must die. Let me appeal to our church leaders. We are concerned about sending out the wrong message. We are concerned about creating conditions where the public may develop the wrong attitude, while we continuously ask all our churches to pray for us, including on Ebola. Where we are now is that anything that will attract possible victims and those infected to come to large prayer houses where they will travel with people, where they will sit with people, where they will be in contact with people that are not infected, it will be very, very dangerous. This will be one way this virus can spread beyond control. So, I had made the point earlier. Those who are sick, please, let us take them first to a health facility where they will have care, or those who have had contact, let them please report themselves to a health facility and get quarantined. Then we can ask our churches to pray for them where they are.
Oh, quite true. Now, a suspected case of the Ebola virus has led the Nigerian National Petroleum Corporation (NNPC) to indefinitely shut down its clinic located in Lagos. The management announced Friday. Group General Manager, Group Public Affairs Division Ohi Alegbe released a statement confirming the indefinite shutdown of the NNPC hospital located in the Mori Okola area of Victoria Island, Lagos, after a patient suspected to have the Ebola virus was admitted at the clinic. It was discovered that the patient visited the first consultant medical center during the period the first Ebola case was reported at that clinic. Alegbe added that the preemptive step was taken after the case was duly reported to the Federal Ministry of Health as well as officials of the Lagos State Ministry of Health. In the meantime, all contacts with this case are being traced and adequate precautionary measures, instituted to contain the possible spread of the disease. Meanwhile, the federal government is appealing for volunteers to help in handling the Ebola outbreak in the country. Medical doctors in public health institutions in the country are on strike, and that is said to be having serious effect on the treatment of those who have been diagnosed with the Ebola disease in the country. The federal government has now joined the Lagos state government in announcing life insurance and special incentives for any medical worker who volunteers to help out in the Ebola crisis.
One of the challenges is getting volunteers and getting all manners of health workers. We need doctors, we need pharmacists, we need nurses, we need laboratory scientists, we need those who will do administration, we need those who will be in the security. We need everybody who wishes to volunteer. Will train you. You're going to be part of this. However, the government, through the head of civil service of the Federation, yesterday approved a number of new positions empowering the Federal Ministry of Health to do emergency recruitment of necessary personnel that will be part of this battle. Government also approved that all those participating in the care of Ebola virus disease patients and also even participating in contact tracing, all those part of the team should enjoy life insurance provided by government.
Well, it appears the states are not folding their arms in the light of the Ebola threat, and they're obviously doing something. Now, as part of efforts to guard against the outbreak of the Ebola disease, the Kwara state government has banned corpses that have no death certificate. State Commissioner for Health Abdul Kayode Isa, while briefing newsmen Thursday in Ilorin, said that owners of corpses entering Kwara must obtain death certificates to ascertain the cause of death. He said the request for death certificates for corpses entering the state is to forestall any outbreak since it is contagious. He directed people conveying corpses to the state to register with the nearest health center before going to their destination. Issa said the state government has set up a rapid response committee on the disease to urgently attend to any victims suspected of contracting the disease in any part of the state and called for the cooperation of the people. Now, in Bayelsa State, Commissioner for Health Dr. Ayibatonya Owe has disclosed that the government, as part of measures to curb the outbreak of the Ebola virus, has already set up a 13-man task force to map out strategies as well as liaise with other notable local, national and international health institutions to be on the guard in case any outbreak occurs in the state. Owe said other measures been put in place include training programs for all health personnel in health institutions across the state, as they are mostly the ones at risk of contracting the virus. He said health personnel in the state would be trained in collaboration with the State Ministry of Health, World Health Organization, Federal Ministry of Health, and the Center for Disease Control. He added that the Federal Medical Center Yenagoa and the Niger Delta University Teaching Hospital have been designated as centers to handle patients in case of an outbreak of the disease in the state. Now, in the same vein, the Abia State government has designated some hospital wards across the state to handle patients who show any symptom of the Ebola virus disease. Abia State Commissioner for Health, Dr. Okechukwu Oga, while speaking to newsmen, said proactive steps had become pertinent in forestalling any outbreak of the Ebola virus, which is widely spreading in West Africa and beyond. Aside from designating hospital wards as Ebola centers, Oga said the State Ministry of Health has also embarked on massive public enlightenment campaign to sensitize the people of the state on symptoms and ways of prevention of the Ebola virus disease. Now, the World Health Organization has declared the Ebola epidemic in West Africa an international health emergency. WHO officials said a coordinated international response was essential to stop and reverse the spread of the virus, which has killed scores of people in 4 West African countries. The announcement came after experts convened a 2-day emergency meeting in Switzerland. So far, more than 930 people have died from Ebola in West Africa this year. More than 1,700 cases of Ebola have been reported in Guinea, Liberia, Nigeria, and of course, Sierra Leone. To some business news now. The Central Bank of Nigeria has revealed plans to auction 100 billion naira in bonds with tenors ranging from 3 to 20 years at an auction next Wednesday. The Debt Management Office of the Apex Bank made this known Thursday, stating that it would offer 15 billion naira in 3-year, 50 billion naira in 10-year, and 35 billion naira in 20-year debt, respectively. Turning to the foreign scene, U.S. President Barack Obama says he has authorized airstrikes against Islamic militants in northern Iraq that will not send U.S. troops back to the country. He said Islamic State (IS) fighters would be targeted to prevent the slaughter of religious minorities or either threaten U.S. interests. Strikes have not yet begun, but the U.S. has made humanitarian airdrops to Iraqis under threat from the militants. IS has seized Karakush, Iraq's biggest Christian town, are forcing locals to flee. The Sunni Muslim group formerly known as ISIS has been gaining ground in northern Iraq and Syria for several months. U.S. airstrikes would target IS fighters if they threaten Baghdad or move towards the Kurdish capital of Erbil, where there is a significant presence of U.S. diplomats and military advisors, Mr. Obama said. Some sports now. Arsenal has agreed to sell its captain Thomas Vermaelen to Barcelona for a fee of around £15 million. 15 million euro, I should say. Pounds, yeah. It's pounds, actually. The 28-year-old must now agree personal terms with the Catalan giants and pass a medical. Vermaelen was a target for Manchester United, but they ended their interest after refusing Arsenal's demand to receive a player as part of the deal. The Belgian had been the subject of a bidding war between Barcelona and Manchester United as his move to to the Spanish club is likely to be completed this weekend, ending the centre-back's 5-year stay in London. Ivory Coast striker Didier Drogba has announced his international retirement from football. The Chelsea forward, who had been captain for 8 years, took part in 3 World Cups and 2 African Cup of Nations before announcing his retirement on Friday. It is with much sadness that I have decided to retire from international football, the 36-year-old said in a statement. Well, I believe he now wants to concentrate on club football, and let's just hope he does well for Chelsea Football Club on his second return this season. On that note, we end news now. We thank you very much for watching. I am Deji Bademasi. We're back again tomorrow.